So this is my invitation. Please get involved. Some of you already are involved. We've had a number of lots of members from SRCD that have attended these workshops. Some have actually helped organize some of them. But remember what we've seen so far, just a few early smatterings. I'm sure that all of you saw a slide on something and said, how come something isn't there? Or, my gosh, you didn't even have a slide on something. That's great. What a wonderful opportunity for you to educate us and contribute to this. It may just be that I didn't film the slide. But send your ideas in. We really want to see that. What's going to happen at this June meeting is we're going to have people sitting down together with the white papers and all of the comments that came in about those white papers. So vote early, vote often, put in your ideas as much as you can. And so it's nichd.nih.gov/vision, or just much easier, just type NICHD vision in any search engine, it should pop up. So at that point, I'm going to stop, and I hope I saved us a few minutes for questions. I'm getting nodding up here anyway. I think nodding that they're nodding yes, not that they're nodding they're asleep, okay. So I have time for a few questions, thoughts. You can add things in now. It's always good when you come to give a talk and you've got some of your staff in the room that somebody's going to applaud. So thank you all. You still have your jobs. Thank you for starting the applause. All right. You can go have dinner now if you want to, right? Any questions or thoughts about that you want to ask just in front of a few friends instead of in the confidence of an email? Do we need people to go to the microphones? Should we? If you would go to their microphones, at least back there's a microphone. So if you don't mind traipsing to the microphone to ask your question, that way people will hear it.
Hi, this sounds really great. I just want to know if this data will be available internationally.
In terms of the National Children's Study?
Yes.
Absolutely, absolutely. Do you pay your electricity bill when you have a computer?
Yes.
Yes, then it will be available to you.
Very good. There won't be any...
If you don't, we will try to mail it to you, but it won't work as well. Okay, no, absolutely. It will be available to anyone.
Excellent.
And I should stress it will be available to anyone, and we in fact are talking to a number of similar, they're not exactly the same, similar studies in other countries to see if we can't, in fact, gather the data in a way to really sort of favor being able to pull the data as much as possible. Take the long walk. Remember, it's good for you.
So I was just curious, looking at the list of workshops, which really define the product, right? It's what you put in the workshops are critical. Mm-hmm. What happened to emotions and relationships, and how is that being thought of in terms of the whole issues of what NICHD should be?
Sure. Good question. So it clearly fit in terms of the conversation in several of the workshops. Our problem was in designing, you're absolutely right, the design of the 9, and originally it was 10, and we smushed a couple down to get the 9, was our mission, which includes, besides what we're named after, child health and human development, which is quite important to us, it's also maternal health. It's, in fact, all women's health except for cancer. It's all rehabilitation medicine, so we have a fairly large warrant. And so as we were doing that, we thought, well, gee, if we had 50 workshops, we actually could have one on everything we do, but that's not going to work. So in doing that, we had to look for some broad themes, knowing that exactly the kinds of things you're bringing up, and there I can bring up some other examples of that, would need to be incorporated in the thought. And that's also a major issue for when we go to this June meeting, to see what's missing. So particularly if you have concerns like that, I would look at the white papers. A few of them are up now. All of them will be up within the next 2 to 3 weeks. Look at the white papers, and if you see things that you think have been missed, call them to our attention. That's part of the reason for the iterative process. One more question if there's somebody else who wants to take a walk.
I'm just wondering how you're communicating with the rest of NIH and actually the rest of HHS, because the whole life course framework is really emerging so strongly in the origins of disease and disorder. How are you keeping up with that in a structural way?
In various ways, and tell me more about exactly what you mean by that, because that same verbiage can describe at least two different phenomena.
Sure, developmental origins of health and disease.
Yeah, that's what I thought. As you may have noticed, many of you, there was a specific one of the 9 workshops was exactly on that. The idea of the child as father of the man, and I would note mother of the woman, that we actually, for the first time ever, begin to have more and more evidence that that's true, and we certainly know that's true of human development, but we know it in a richer way in terms of human development, in terms of human health, in terms of disease X whatever, cardiovascular disease, whatever, we have growing evidence of that. And if you were going to, if you were going to bet money on, what are going to be these major scientific advances of the next 10, 20 years, clearly this developmental origins of health and disease would be, I think you'd want to put some of your money there. It's going to really, I think, go a long way in that period. So there are multiple, at the NIH alone, there are multiple institutes that are interested in that, because it doesn't matter whether you're interested in heart disease, or if you're interested in diabetes, or if you're interested in cancer, or if you're interested in whatever, then you're interested in this topic. So multiple organizations at the NIH are working. I think we at NICHD think we have a certain particular responsibility for this, because in fact, much of that happens during fetal life, early childhood, which is where we have communities that know how to think about those periods. So I think we see this A as very important, B as our having to take a leadership, and we would like to take a leadership role in this. And you're correct in saying it's not just at the NIH, it's in fact involves other federal agencies and others. I think this is an area where we can have huge impact upon health, well-being, not just for kids, but for adults. And also, I must say, I'm aware of the fact that if we can do that, maybe society will actually even get in some ways more interested in child health and well-being than they have been, because of our evidence that, gee, whether it's simply in terms of the economic return you get in doing that, the societal return, however you think about it, that it makes more and more sense to focus on childhood. So that's very important. I'll give you the $5 a little bit later. Thank you for asking the question. And with that, I think I'm done.